Good evening. I'd like to share with you the basic protective measures against the new coronavirus. We need to stay aware of the latest information on the Covid-19 because, as we know, there is an outbreak of this virus not only in our country but also in many other European countries and all over the world. We need to take care of our health and to protect others by doing the following. Wash your hands frequently. We have to wash our hand regularly and thoroughly. Clean our hand with soap and water or with alcohol-based hand wrap. Why? Washing our hands with soap and water or based alcohol hand rub kills viruses that may be on our hands. Maintain social distancing. We have to maintain at least 1 meter distance between us and anyone who is coughing and sneezing or sneezing. Why? When someone coughs or sneezes, they spray small liquid called droplets from their nose or mouth, which may contain virus. So, if we are too close with them, okay, we breathe this droplet, including the COVID-19 virus, if the person coughing has the disease. Avoid touching eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hand can transfer this virus to our eyes, nose, and mouth, and then the virus from there can enter in our body and make us sick. We have to practice respiratory hygiene. We need to make sure, and the people around us follow good respiratory hygiene. This means we have to cover our mouth and nose with our bent elbow like this. If we use tissue when we cough or sneeze, we need to dispose the used tissue as soon as possible. Why? Droplets spread virus by following good respiratory hygiene. We protect the people around us from a virus, from many kind of viruses like flu, cold, and COVID-19. If we have fever, cough, and difficulty breathing, we need to seek medical care early. And we need to stay home if we feel unwell. If we have a fever, cough, and difficulty breathing, we need to seek immediately medical attention and call in advance. I just want to add another final consideration. We have an excellent healthcare system that is working beyond extreme conditions. We have just heard just last night, about new provisions taken by the government to reduce spread as much as possible. If only anyone would feed advice, but there are still some ignorant and egoist person that think that these rules do not apply to them. They don't get the fact that they may be spreading the damn disease. Here are some sensible advice or precautions to take in the light of coronavirus. As you know, we live in a lockdown country, so I just want to summarize what in part I have already said in the first part of this video. Stay home, number one. Number two, avoid crowded places. Number four, don't touch mouth, nose, and eyes with our hands. When we cough and sneeze, we need to do it in paper hanky, then throw away, otherwise into the crook of our elbow, like this. We have to change air in our rooms frequently. Avoid handshake and hugs. Don't take medicine unless they are prescribed by the doctor. Don't go to the emergency service, but call doctor. Why wipe door handles and tops with disinfectant? Wear mask if we go out. Wear gloves if we go out. Please take heed and take great care of ourselves. Thank you for your attention.